Hey, everybody, welcome to Anatomical Gangster. I'm your host, Sue Hitzman. If you're new to the podcast, first, thanks for being here. Please click that subscribe button and share this one with your friends. If you're curious about the human body, the human experience, and what it is to be in your body, you've come to the right place. Anatomical Gangster, I'm always talking to people who can break complicated topics down into simplified terms, but are oftentimes off the beaten path of what traditional science and research is sharing. And today we have an extraordinary privilege of speaking with Dr. Jean-Claude Guimberteau. He's a surgeon turned fascia educator whose groundbreaking contributions have reshaped my understanding of human anatomy. I am truly forever changed because of his pioneering work. He's created 7 films and 3 incredible books. And Jean-Claude has brought fascia, this overlooked ubiquitous material within our bodies, which is actually vitally important, into the limelight, which has really inspired countless professionals, including myself in the field of healthcare and movement science, to think differently about what we call a connective tissue. We're going to find out from him that this is more than just a connective tissue. This is a stability architecture. It is what constitutes our living being. It is, in fact, a system that vibrates and possesses frequency that allows all of the other definable elements on our body to have space, continuity, and connectivity with everything else. Now, when I first encountered his transformative work was in 2007 at the Fascia Research Congress. It really had a profound impact on my journey as an educator, and I have continued to share one of his pioneering videos, Strolling Under the Skin, with so many of my instructors, and I find his work so incredibly valuable. Now, as we celebrate this upcoming launch of his 12 conference course collection. It's called The New Frontier of Anatomy. I'm thrilled to dive into his visionary perspective today. We're going to explore his latest collection of videos, learn a little bit about his fascinating transformation from a successful surgical career to an educator on this intricate and beautiful dynamic world of fascia. So I hope that you enjoy this conversation and you share it with your friends. And here is the amazing Dr. J.C. Guimberteau. Well, JC, thank you so much again for coming on Anatomical Gangster. It's always a pleasure to see you and to chat with you. And we are so excited about this new 12 conference course called The New Frontier of Anatomy that you are now launching. And for people in a backstory here, I met JC in 2007 at the first Fascia Research Congress, and you presented Strolling Under the Skin, which was this incredible footage of fascia in a living human body using atomic force microscopy. And I think that in that moment, you solidified for me this idea of this fluid matrix that is in a constant state of adaptation, that there's some frequency, that there's a communication element of fascia that is undeniable. And watching those videos really landed it for me. So first of all, thank you for creating that incredible video.
Yeah, no, thank you.
That was one of my amazing ones. So with this new 12 conference course, I really love it because it's 10 to 15-minute videos. But I'm curious, what do you hope participants will take away from the collection of the videos?
Well, first, I want to show how is beautiful living matter, because it's really beautiful. And I think that people have to observe this living matter, colors, humidities, moving, and thanks to this observation, they can love their own living matter, take care of their own living matter. So first, beauty. And then the second point is a scientific point of view, is how can we explain the continuity inside the living matter, the continuity and the mobility in the same time? Because the problem is not only to have continuity to explain how we are built, but we have to explain at the same time we are built and we move. And it's not so easy, because at the university, we don't approach this kind of problem. we are only focused on the musculoskeletal concept, muscle and skeleton only. But around muscle, around skeleton, you have a lot of things. And we never take all these things in charge. And so I have tried in my surgical life, I have tried to understand how are sliding things, gliding. And so little by little, I use photos and then videos and then endoscopy and by microanatomy to try to explain, to understand first, and then to explain how is it working. And the third point is that when you accept this kind of conclusion, this way of thinking, you open a lot of scientific fields. You are not only on one side of the medicine, you open to thermodynamics, quantum physics, complex system, and so on. So you can include your own living way in all the scientific fields open now. So it's 3 steps: beauty, understand mobility, and then opening to other scientists.
Yes, and I think what's fascinating about this body of work, again, you've had 7 films you've created, you've got 3 books, and watching the process of this particular collection going from the skin all the way through every aspect that you would even think to consider about connecting system, that fascia sort of takes a different, I guess, viewpoint than probably most doctors or clinicians have considered fascia to be. And for you, you've been a hand surgeon for decades. I remember in our last.
So not only hand surgeon. First, I was general surgeon.
Yes. And I asked you, like, how many surgeries did you? And you said something like 50,000.
Yes, wrong.
And
yes.
and where was the point for you when you went from doing surgeries and then suddenly thinking more about the tissues you were cutting through? Did you always have a fascination with it, or was there a real point in your career where you're trying to do something and in some ways fascia is getting in the way?
No. I changed my mind when I decide to understand how is working the sliding system around tendon and muscle. Because I had to reconstruct tendons using academic procedure, but the result was not very good. We had to do it with at least 2 times, sometimes 3 times. That means 1 year out of work for the patient. So it's a lot.
A lot.
So on one side, bad result, a lot of time. So I decided to change. And so I describe a new technique, a new procedure on one time using vascularized tendon. And around this vascularized tendon, I have preserved all the sliding area, giving sliding system. And I decide one day to explore this tissue, the sliding tissue.
In a living body. In a living body.
In a living body, yes.
Let's all point that out for everybody.
And so I observe a fibrillar world, only fibrillar world. And I say myself, the solution, the explanation of the sliding is in this fibrillar world only. So I have to understand how is it working. And not only how is it working, but why this fibrillar world has a completely irregular framework.
Mhm.
Why irregular? And why this irregularity gives efficiency. So you are in a new world. You are out of the linear world, and you are entering in a non-linear and complex system.
Yes, and I know, when we've talked before, I think something that really has stuck with me is that in living matter, there's no straight lines. There's no straight
No.
lines. There's only right. And so we look at the physical form and we are so focused on the linearity of a muscle. These, muscles have directions and these fascial lines and things. And I think those are nice models. They're nice models. But when you take the 30,000 foot view of fascia, and actually 30,000 microns in, right? Like you're in the body, you're realizing that the chaos is actually what maintains its complexity and its ability to do all of the things it does for us, that it's not just connective tissue, it's a communication system. It's allowing cells to communicate, it's allowing nerves to stay stable, it's allowing everything to function. I find it fascinating that the most abundant material in the body really has been one of the least researched aspects of the human form, and there's so much there. Why is it that it hadn't been more studied earlier?
Yes, that's a big problem.
Yeah.
Not only this problem has very few study, but this problem has been studied on death, cadaver, or dead fragment,
Right.
never on living people. And but it's very difficult to approach people when you are talking about your own living system, because it's a sort of taboo. You know what is taboo?
Yes.
It's a sort of taboo. You have a lot of explanation. You have a lot of, so it's too complicated to approach all this explanation. But now we have all the technology to do that. We
Yeah.
have endoscope, we have cameras, we have a digital system. We can do that, so we have to do that, because we are interested by the truth, by the explanation of things. And I don't want to close my eyes. I want to understand. That's all.
Do you think that if a surgeon saw your footage, do you think it might make them think differently about their surgical procedures?
Well, all my colleagues, and I am, and we are technician. We are technician. So we have to do the job and in good condition. So we are technician. But some of them, not all of them, but some of them are interested because they want to understand how is it working, what they do, and they try to avoid to destroy all this living matter if it's not necessary. So all the young surgeons now are trying to make surgery with endoscope.
Oh, I see. They are
Yeah.
actually using it in their surgeries.
Yes. So you have small incisions, small scars.
Right.
And so I think
Like
it's
with the Da Vinci, these new big machines. I know that some people are getting
yes,
these
yes,
types of
yes,
surgeries where the surgeon's actually like at a joystick over
yes,
here,
yes,
and this
yes, yes,
machine is actually doing the surgery.
yes, yes,
And that's
yes, yes,
fascinating. It's
yes,
a little scary, but fascinating.
Yes. And so the young generation has a different idea compared to my generation or the former generation, because at that time uh, you have to remember that just before the Second World War, one patient on 4 was dying during anesthesia.
Hmm.
So at that time, if you had to go very fast during surgery for the
Yeah,
surgeon,
sure.
go fast, go fast, go fast. So if you want to go fast, you need large incision. Otherwise, it's very difficult if you have no time. So at that time, you are a good surgeon if you use large incision. Now, it's completely the contrary. You are a good surgeon if you use small incision. So it's much better.
Hmm. Yeah, I don't know if that's actually true. My mother started out with 2 tiny scars on her leg, and now she has a huge incision because they had to revise the bad surgery at the beginning. I don't know if that's always true, having small incisions. So,
Yeah.
even with that, JC, when I think one of the big things that I learned from you that really landed for me was talking about scars, which is one of the conferences in this 12 conference collection.
Yeah.
And I always think to myself, I remember a friend of mine getting a massive surgery. And when she went back to the doctor, it was a big abdominal surgery. And the doctor said he was very proud of the scar. He was like, "Isn't that an incredible scar?" And while on the surface, it looked very pretty, she developed a ton of low back pain. And when she came to me, there was so much fascial adhesion well deep into her abdomen that was actually conflicting with the way she was moving. It changed her general motion. And then she started having back pain. And I went in with these very light touch techniques with my hands and opened up some of the unnecessary, I don't even know what to call it, more seriously kind of scarring that was really not necessary to be there, and freed up her back, and she avoided a surgery. But I think that just because a scar looks good, the underlying plane of fascia has been forever changed. Can you talk a little bit about that? Because I think anybody who's had a scar should know that they need to touch the scar. They need to massage that scar.
When you are a surgeon, when you are making scars, you have to be in collaboration with osteopath or physiotherapist just after the surgery. If you want to avoid adhesion, because when you have adhesion, all the fibrillar behavior, the mechanical comportment of the fibrils is completely destroyed. So if you want to rehabilitate it, you have to move the skin, you have to move the fascia, you have to move the fat, you have to move all this tissue after the surgery, not 6 months or 1 year after. No, just 10 days after surgery, you have to begin the rehabilitation of the skin.
Yes. And I mean, I've been working on my mom, again, she just had this new surgery just 2 weeks ago. And while she has this huge piece of, you know, um, plastic around where the scar directly is, I'm not working there, but I'm working on her inner thigh. I'm working behind her knee. I'm working on all the tissue that is ultimately connecting to there. And
Yes, of
once the
course.
scar has fully healed, there's no seeping, there's no opening, then I'll go closer and closer toward the scar. And I think anyone can do that to themselves. They don't necessarily need a practice. Of course, it's better if you have a practitioner, but I
Yeah.
think that knowing to touch a scar, I think is a valuable message to people, because a lot of times, especially for my clients who have a cesarean, they just want to forget that whole thing. They were thinking they were going to light candles and sing Kumbaya, and they were going to have this natural birth. And all of a sudden they're having an emergency C-section with big lights and a whole bunch of trauma and stress. and they want to forget about it. So they just wait for the hair to grow over the scar and whatever. But I think that's a disservice to the body, because you have permanently changed the underlying substances that we call fascia, and that can lead to unnecessary adhesions down the road if you don't spend a little time with it. So,
And it's good for that, but it's also good because when you move the scar gently, the patient is not afraid by that. He's not afraid by the scar. The patient understands that you can touch the skin without pain. So there is a sort of a training of the patient concerning its own scar.
exactly. So important. So, JC, I want you to talk a little bit about this 12 conference collection. This is really exciting for people. Not only do you get 12 conferences, but also we've incorporated 2 of your full-length feature films as a bonus to attending this. There's Q&A, there's all these added bonuses within this. But talk a little bit about what somebody could learn as an objective of why did you put this together, and what do you hope the outcome is for people?
Oh, no, all the conference, in fact, I'll divide 12 conference. The first one are what I have observed. Only look and observe with me the reality of living matter, of living, really living matter. The second point is how can we have some ideas or proposal concerning what we have seen? How can we understand that? And which kind of conclusion can we have concerning how the body is organized, concerning how we can manage the scar, for example, how we can understand the moving of the skin when you practice massage. And the third part is we have seen that this fibrillar network is irregular. We have seen that the fibers are dividing just at the moment of, how can I say, just when it's need, not before.
Yes, I think it's like almost like a pre-stress, just like as if I'm thinking I'm going to get up, that the tissue is right in the thought I'm going to get up, the tissue is already adapting.
Yes, it's instantaneous. So you have irregularity, you have instantaneity, you have unpredictability. And so you open to quantum physics, you open to complex system, chaotic system, and all these, how can I say, biophysics is now included in my own body.
Yeah. Yeah, I think that actually when I look at fascia, I think of mycelium. And the mycelium that is helping trees to communicate, that trees are in conversation, not through their roots, but through the mycelium, this intricate network of mushrooms in a sense. And I feel like our body, we have a mycelium in us, which is this, this chaotic, haphazard system, which actually has a very divine purpose and has, again, a lot of complexity that I think the big thing I saw happen in 2007 was that a lot of people really grabbed onto the fascial conversation, but they went too macroscopic in their understanding when what we're talking about is the microscopic elements of it. So for people listening, like when Robert Schleip was talking about active contractile cells, people instantly said, oh, that's what makes you feel tight and stiff in your muscles. And it's like, no, wait a minute. We're taking a microscopic element of pre-stressing tissue, all the way out to your biomechanical behavior, you're taking too big of a leap without fully understanding fascia as a cellular, or I guess an extracellular system. And when I met Tom Findlay, who was the amazing scientist who said we need to have a fascia congress, and he would just start sending me research papers, and I had never really thought to consider fascia on this microscopic level. And as I did, it kind of changed everything that I understood about anatomy. It actually kind of destroyed a little of my traditional anatomical mindset. It really kind of train wrecked it a little bit for me.
It had been the same for me. It had been the same.
Yeah. I mean, it literally, where you're like, God, I mean, that's like, actually, I think some of our anatomy is wrong, which God forbid we tell everybody that anatomists
No,
like
it's
Paulius
not.
aren't. It's
It's
incomplete. Incomplete.
It's,
Let's call it incomplete.
yeah, but it's not wrong. It's
Wrong.
incomplete.
It's incomplete. It's incomplete. So, you have so much knowledge. And I think that something I've heard you say now a couple of times, which I'd love for you to help listeners understand, is that fascia, we talk about, you've said the words fiber. We talk about it as a fluid matrix. And you're also talking about fibrillar architecture. And they're three very distinctive things: a fiber, a fibril, and fluids. Can you help for people who are maybe hearing about fascia for the first time? Maybe they're like, what are you guys talking about? This substance in our body that's actually providing us our shape, that is absolutely important to everything from birth on out. How can we help listeners understand the matrix as a fluid matrix, a fibrillar architecture with collagen and elastin fibers?
Well, in fact, you have always the same framework. That means it's an intercrossing of fibers in the 3 dimension of space. When you have mobility, the space between the intercrossing of fibers is full of glycoaminoglycan.
That's fluid.
So, yeah, it's fluid. So it's good for mobility. But when the intercrossing is full of cells, you have an organ. You have a thyroid, or you have glands, and so you have, but it's always the same intercrossing, the same intertwining. It's always the same way.
Mhm.
So mobility, or very often I say productivity with glands and mobility with a sliding system. But it's the same, in fact.
Yeah, I think one of the most fascinating things, I think, when I look at fascia, and I can see where the idea of fascial lines and layers comes into play, because if you're dissecting in a cadaver, it's sort of a selfie. It's a snapshot. It's an instant of time when we've removed the fluids, or whatever, the embalming, or even if it's an unfixed cadaver, but the energetic force of the body is no longer. And but what I find fascinating is how the body has deposited different amounts of the same molecular structures in different areas. So for example, the IT band is such a thick fibrous layer, but then if you really start to look at it, it's actually many fibrous elements towards it. But then my skin, I can pull up on this and let it go, and it goes back to its ideal shape. I can't do that with my IT band. And I find that such an amazing thing of the human design, that our bodies are designed in this colossal way, that I started as this tiny thing and turn into this. And I just, I don't know, I get very bewildered with the idea that how is this incredible design produced? Like, how does the body know where to lay down more collagen or more elastin? Is it movement itself that forms the differences? What is it?
Yes, but well, you can explain. First with the gene, OX gene. OX gene give, how can we say, the plan, how to do.
Right, the map. Yeah, a roadmap.
How to do. And then, but it's my hypothesis, and then you have the fibrillar network giving how to do, not it's not the same, but it's difficult for me. For example, you have an architect. If you want to build a house, you have an architect, and then you ask a mason to build a house, and then you have to use material. And so in the body, it's very schematic, what I say. It's very schematic. But the fascia, I think the fascia give the orientation of things to build them.
Yes.
I think so. It's an hypothesis because, well, it's an hypothesis, yes. But, well, you know, I don't want to be the one who knows everything. Just I want to propose what I have seen, what I have seen, what I think, and what I propose as solution. That's all. After many people will try to speak about, to criticize, but my job is to show. Under the skin, it's like that. And then you can think, if you want, what you want, but you have to think through this kind of observation. Otherwise, it's not thinking, it's imagination.
Yeah, that's beautiful. It really is. I think it opens up a door to, I think, caring for a body more, that there's something more than muscles and bones. I grew up in a time in the 70s, right, where they said, you know, eat right and exercise and you're going to live an active life and everything's going to be great. But then I'm, you know, jump ahead 28 years old and I'm crawling to the bathroom because my foot hurt so bad I couldn't stand up on it. And the first diagnosis that I had was plantar fasciitis. It was the first time I had ever heard that term. And I remember thinking to myself, inflamed fascia, how does your fascia get inflamed? Like, and how do you fix inflamed fascia? Like I don't know, there's no exercise for that. Or do you ice it? Or what do you do for inflamed fascia? And what it did was it sent me down a road of discovery to, I think, appreciating the fact that this, again, is an abundant material that you can actively participate in treating and stabilizing and improving its efficiency so that the rest of your body works well. So I think that this conference collection is for the gamut of human beings, the curious person who kind of wants to take a look inside the body and what am I made of, and what is it that holds me together? How come I don't look like an amoeba and I'm just blobbling around everywhere, right? All the way on out to osteopaths, physical therapists, occupational therapists, and medical doctors. I think that anyone curious about the human experience, about a living system, I think that you've really given people a true gift in this collection. It opens up, I think, a lot of doors to new ideas, new curiosity, and maybe people loving themselves a little bit more because of what they see inside.
I hope.
Yeah, I think so.
We will see.
I think so. You know, looking back, what would you say has been the most rewarding part of your journey in educating others about fascia? Like, are there any particular moments or milestones that really stand out for you?
Well, maybe it's a mechanical behavior of the fibers. So I think it's a mechanical behavior of fibers.
I love that. I think that that's a big deal. So, JC, I ask everybody this last question on Anatomical Gangster. I'm going to ask it to you. If you could tell somebody something that you've learned in your life that has given you more peace, has connected you more to the human experience, and if they learned about it or they thought about it, it might change their life, what would it be?
I don't know. I don't know. Well, if people can change their way of thinking their own body, their own body, for me, it could be a good thing, a success.
I think so too. I think it'll make people love ourselves more. Well, JC, thank you again so much for coming on Anatomical Gangster. I hope everybody has enjoyed this conversation, and we'll see you all on the next conversation.
Okay, bye-bye. Thank
Bye-bye.
you. Bye.
I hope that you enjoyed that conversation as much as I did. I am so fascinated with JC's work, and this 12 conference collection. Again, I think for anybody curious about the human body, you're going to really love what you learn. And it's been really fascinating for me to take his work and infuse it into the practice of the melt method. He's been pioneering. It really has changed my life. So I hope that you will check out this 12 conference collection. I'll leave the link in the show notes. And if you're new to the podcast, again, please subscribe. And thank you again so much for joining us on another talk that gets hopefully people more curious about the human body and what it is to be in a living form. Thanks again for joining me. I'll see you on the next podcast.